Hello everyone. So today I'm going to talk about achondroplasia. And what is achondroplasia? It reflects a problem with the cells of limb bones. Even though the chemicals signaling the cell division are present, the bone cells fail to divide, and the arms and legs remain short, and the patients basically patients will remain certain height and will never grow um, uh, for entire his or her life. So androplasia is caused by gene mutation in the FGFR3 gene. It is the only gene known to be associated with this disease. So all the people who have only a single copy of normal FGFR3 gene and a single copy of FGFR3 gene mutation have androplasia, and it is inherited in an autosomal dominant manner. So the disease begins in the developing fetus, and is one of the most common forms of skeletal dysplasia that causes dwarfism. The estimated frequency of androplasia has ranged from about 1 in 15,000 to 1 in 35,000 in birth. So 80% of achondroplasia patients caused by genetic mutation. The remaining 20% is inherent from a parent. A person who has achondroplasia, who is planning to have children with a partner who does not have the disease, have 50% chance for their children to have this disease. So when both parents have androplasia, the chances for them together to have a child with normal stature is 25%, and their child has like 50% a chance to have this disease as well. So this diagram is actually shows what went wrong when in patients who have androplasia. So the two variants in FGFR gene cause more than 99% of cases of androplasia. So both variants lead to the same change in the FGFR protein, and this genetic change caused the receptor to be overly active, which leads to the disturbance in bone growth that occur in people with this disorder. So you can see this picture, as I mentioned before. So the patients will have short legs, short arms, short legs, and you see the legs is not straight, and basically they will have about normal head, large head. So in their entire life the average height will probably 4 feet 10 inches. That's average. So affected individual has rheumatic shortening of limbs, macropophilia, and characteristic facial features with frontal bossing and midface retrusion. And so some symptoms of androplasia, as I mentioned before, people who have androplasia have abnormal bone growth that cause the clinical symptoms such as short stature with disproportionately short arms and legs, short fingers, and large head, and the specific facial features with a prominent forehead and midface hypoplasia. People with androplasia would also have breathing problems, Other health issues include obesity, recurrent ear infection. Adults with achondroplasia may develop pronounced and permanent sway of lower back and bone legs. So some diagnosis of achondroplasia is including X-ray, physical examination, obviously genetic testing, and usually testing at the FGFR3 gene, and also you can do MRI or CT scan. So treatments, no specific treatment is currently available for curing achondroplasia. However, vosoritide is C-type nucleoside peptide analog was recently approved by the FDA. It is to enhance the height in the individuals already with achondroplasia from age of 5 years until the growth plate close. So that will conclude my presentation, and thank you very much.